monthly in October. The October data has been loaded up on our Ed site for the supporting student participation in 22-23, and you can see the data shows the gray line is before COVID, the blue line is 2021, when we had a lot of remote and hybrid learning. And the orange line is just last year. And so that's the end of the year data in the orange line for last June. And then the light blue at the end is October. So that's year-to-date October data, the percentage of students who were chronically absent, that is who have missed 10% of days enrolled through the end of October. And so if you calculate about 20 days in a school year, those students would have missed about 20 days in a month. 20 school days, those students would have missed about 4 or 5 days. So we're down a little bit as a whole, all students. This is the first group on the left. We're down from where we were last June, but we're still pretty high compared to where we were before COVID. You can see students with every group has gone down. So students with high needs has come down, with the exception of students without high needs. And that is a unique observation. The students who have supports, who are not English learners, who do not have disabilities, who are not eligible for free meals, that their chronic absence rates are going up. And so that might tell us some things that we need to learn. And I don't have the answers to that other than it could have to do with tier 1 prevention strategies, communication, school climate. We want to look at that so that making sure all students feel welcome. But our English learners have seen a considerable a reduction in chronic absence, along with students with disabilities. And our highest group of students with chronic absence, again, every year, has been our students experience homelessness. And we know that that number is even underrepresented, that we have a lot of students who are homeless, who are couch surfing, who would be meet the definition of McKinney-Vento, who may not even be captured here. So we really want to pay attention to those students who may not be in a permanent, stable housing situation and their attendance. So that's where we look in October. So I'm wondering, how does your district look in October? And so I'm going to show you where you can find your monthly data for your own school district and your schools. So next slide, please. And on this slide, you'll see the link is here and the QR code is here. And this is just a screenshot of the web page for supporting student, I should say, participation in 22-23. And it's the monthly attendance report. Connecticut's the only state in the nation that actually has monthly attendance. And we're very grateful for our district level PSIS staff who work very hard to get this data, but it helps us to understand our trends and where we need to put supports. And on this page, you'll see several series of graphs. This graph that's showing here is average daily attendance. Followed by that is the chronic absence graph that I just went over with you. But this little tiny blue print on the left-hand side, the yellow arrows not on the slide screen, are the Excel spreadsheets that you can download that will give you data for every district and every school, and it will break it down by subgroup. So you can go to this page, the QR code's here. You can get to it through Ed site, and or you could search for supporting student participation on the Connecticut webpage. So next slide. So if you open up the second Excel spreadsheet, chronic absence, this is what you're going to get. And so what I recommend for everyone who's working on addressing attendance, and about 75% of our schools and districts are required by law to have a school and district attendance team. That's tripled since before the COVID. I recommend that you have someone on your team who can manipulate Excel spreadsheets. That is something that is really important so that you can look at your data, you can sort it, filter it, remove the other districts. But one of the important things on this, and you'll see all of the districts are listed by alphabetical order, followed by the number of students, and then their chronic absence. After that is extreme chronic absence, which is missing 25% or more. And then these next several rows have to do with daily attendance, and remote learning, if there are remote learning. Remember, we're only allowed to do remote learning now is in a formal remote setting. And we'll talk a little bit more about that the next slide. And then you'll see that this is the October data. And the but along the bottom is, I don't want you to miss, so you can see all the tab for all students. You can see a tab for by grade for each school district, by high needs, by free and reduced lunch, by grade, by primary disability, which is a data set that we don't have easier access to. This will show you of all your students with disabilities, where are the highest levels of chronic absence by primary disability, and then by homeless. And so you can see that for chronic absence for all of your districts. And then there's reports for schools that show daily attendance, average daily attendance. And so once I stop speaking, I will put the links to these in the chat because I have them set aside for you. Any questions regarding this data and how to access it? This is something you can use, of course, be using your local data dashboards, your local data reports that are coming out so that district administrators and school administrators can track attendance even more recently than the monthly data report, but this is available for you. Next slide, please. And I wanted to share with you the standards for remote learning. We recently did our beginning of the year monitoring meetings with many of the opportunity districts, and this is something that has come up. We have students who are missing a lot of school who are pregnant and parenting teens, or students who are working, and students who may have some school aversion, mental health issues. This is new this year for grades 9 through 12 only. There's standards for remote learning. And this is a remote learning program where we have a learning philosophy and we have a definition, and there's standards, and it's very defined how you can do this. It's not just saying, oh, you're going to learn remote and we're just going to give you access to the classroom. No, it's a program with dedicated people. So Stamford has recently been in the papers for the program that they're developing, their Twilight School. And so I've shared the link and I'll put it in the chat. For Stamford lays groundwork for remote learning at Twilight School. This is breaking new ground for us. For many districts, I know other districts are looking into this, and then I'm providing a link for the standards for remote learning grades 9 through 12. Remote learning for grades under 9 through 12 through K through 8, I don't think are going to be available through 24-25. So we've got a little bit of time for this, but this is something that's available to districts and boards to consider if they wish to. Next slide, please. And so with that, I'm going to turn it over to a DCF and the DCF Carline, Education Neglect and Truancy, to bring you up to speed with everything that's happening there and how they can support the work in districts. So Lisa, Daymonde, I'll turn it over to you.
Great, thank you, and good morning, everybody. I am excited to be here. I also have with me Ed Eckert, who is with our CT Kind team, and we're going to talk about the portal as well, hopefully to give you some additional information as we've rolled out a new and improved portal in June of this past year. Of course, it happened right before school closed, so we just want to make sure everybody hears about it and here's about some of the new stuff that we're trying to do to improve it. So, all right, so next slide. Okay, I'm just gonna say it, educational neglect. It's not black and white, it's very gray. There are things that we need to do to work with families, to engage with families and engage with youth, to really assess an educational neglect referral, and what's happening in the child's world that they're not coming to school. So I just want to put that out there, and I will talk about that throughout my presentation. The definition for educational neglect occurs when a school-age child has excessive absences from school through the intent or neglect of the parent or caregiver. So that's our basic definition. just to note, excessive absenteeism and school avoidance may be a presenting symptom of a failure to meet a physical, emotional, or medical need of a child. It is up to us, the Carline staff, to consider some of these additional information or additional allegations at the time that the report is received. Next slide. I put this slide in because I wanted to talk about the criteria, things we think about and when we're assessing a report to us. The first two criteria to talk about are the children from school age until 12, and then the older kids from 12 and up. 12 is the mid-range point when you begin to look at and consider educational neglect. Excessive absenteeism in a child that is under 12 may be indicative of a parent or caregiver's failure to meet the educational needs of a student. However, when you have kids that are older, excessive absenteeism coupled with a failure of a parent or guardian to engage in efforts to improve the child's attendance may be indicative of educational neglect. I just want to note that for children older than 12, excessive absenteeism through the child's own intent, despite the parent or caregiver's efforts, is not educational neglect. Rather, it's truancy, which is handled through the school district. I want to talk about these two things. These are important distinctions when you're making a report about educational neglect. It's really about the efforts that you make to assess the parental capacity or the parent's ability to meet their child's needs. Have they engaged with you? Have you sent letters? What were your efforts to really engage the parent to kind of get to the root cause of why the child is not coming to school? Some other considerations that we look at in characteristics of the child, we look at their age, their health, their level of functioning, academic standing, and dependency on the parent or caregiver. Does that child need that parent to get them to school regularly, like the children 12 and under? In determining the criteria for excessive absenteeism, we also look at the following characteristics of a parent or caregiver. Like, what's their rationale provided for the absences? What efforts to communicate and engage with the educational provider? And is there a failure to enroll the school-aged child in an appropriate educational program? So those are the things that we're looking at when we receive a report, that we're assessing in order to determine acceptance, if it meets acceptance criteria for an educational neglect report. Next slide. I can't see anything in the chat, so I don't know if there's questions so far.
I'll monitor the chat. We just opened it up. So
Okay.
It wasn't open. It's open now. So if anyone has any questions, we'll monitor and let Lisa know.
Perfect. I don't want to miss anything. I know I'm talking at a screen. I can't see people. I miss that in-person thing, but this is awesome that I have this opportunity to really talk about it. But I really would like to answer any questions that you may have. This next slide I put in to really talk about the school age child. The definition of a school age child is a child that's 5 years of age or older and under 18 who is not a high school graduate. Some of these are important, for us as we define what a school age child is. A child age 5 or 6 is not required to attend school. The educational neglect only occurs if a child is enrolled at 5 or 6 and does not attend school or receive home instruction. So there are the little distinctions that sometimes people ask, well, how come if they're not in school? So, I'm making educational neglect referral, but if they're not enrolled at 5 or 6, it's not educational neglect. Let's see, sorry about that. If you're older than 12, again, excessive absences through the child's intent, despite the parent or caregiver's efforts, is truancy. And just to let you know, a parent or child having control of a 17-year-old may consent to such child's withdrawal from school. The parent or person shall personally appear at the school district office and sign a withdrawal form. Failure to sign a registration option form for a child is not in and of itself educational neglect. Okay. Again, I know sometimes oftentimes I'd like to give as best, a definitive answer on things, but when it comes to this type of allegation of educational neglect, you know, it's gray in a lot of areas. And it's really about, and I'll say it again, it's about engaging the family to figure out what's happening and how we can be most helpful. Next slide. Oh, I put this in. I don't know, many of you may have seen this. We put this slide together probably right in the middle of COVID, to really help everyone kind of figure out what is neglect, what isn't neglect. So I put it also in this PowerPoint presentation, and I'm hoping, Kari, they can have this, right? They're going to get this. Okay, because I'd like them to be able to have some of these things that I've highlighted so they can always refer back. So we put this in early on, and I think I took out one bullet that previously talked about them not having a computer wasn't necessarily neglect. We had gotten early in COVID, we had gotten a lot of reports about the student didn't have the ability to work remotely because they didn't have a computer. Is that neglect? So I took that one out because we're a little further along now coming out of COVID. But I wanted to put this in. And, you know, I wanted to have you think about the third bullet, where it says parent caregiver response should be considered. And some examples to think about, you know, a parent's disagreement with an educational plan is not necessarily educational neglect. A parent indicating the family is in crisis and not prioritizing educational needs currently, but has plans to stabilize is not neglect. Again, that was early in COVID, but it also applies now. It's really trying to figure out what is happening within that family that the child isn't coming to school. A parent that has told the school they are homeschooling with their own curriculum while schools are closed is not neglect. Again, that was an old one. And a parent that has all necessary resources has provided no explanation for their elementary age students' lack of participation or attendance and is not engaging with the school regarding the reasons for the lack of involvement may be neglect. So I wanted to kind of point that out again to everybody. Efforts, you know, still need to be made by you all to engage a parent. I keep talking about this. Efforts should be more progressive and aggressive and documented. These are things that we need. Oh, I see a hand up. This is great. We see this a lot, and oftentimes we're asking, like, tell us about the efforts. Tell us about what efforts have been made that you're now calling in a report for educational neglect. I'll take the question now.
Okay, so there's two questions in the chat.
Sure.
Lisa. So the first is, if you make a home visit and parent and student persist in their intent to withdraw a student, may they sign the withdrawal form during the home visit rather than appear at the school? Our experience is parents agree to come and withdraw, but don't, and student still doesn't attend. So I think that's something I can respond to.
Yep.
Right?
Yes.
So, yes, a parent can only withdraw a student if the student is 17 years of age or older. An 18-year-old can withdraw themselves, but they must have an opportunity to meet with a school counselor to understand, to hear what their options are before they sign the paperwork to withdraw their student who is 17 years of age or older. And the school counselor has to attest to the fact that they met with the family and that they reviewed these options. That can happen in the home. It doesn't have to happen in the school. If you're having trouble having a family come to the school, it's certainly okay to have that meeting in the home. But I just want to make sure that the understanding is the age of the student has to be 17 years or older, and that they have to have that counseling session so that they can learn what their options are and not just be released from school. I hope, Marianne, that answers your question. And the second question is, so just to clarify, since I'm in middle school, if a child is not attending and parent does not respond to calls, but that student is 13 or 14, is that still neglect?
I would say if you've made a home visit and you've made all your efforts to try to engage that family, I would say call it in and we'll assess from there. I can tell you recently, there was some pushback from one of our area offices to not accept one. And when I had reviewed it, I looked at the child was now 14, and I had read the history because we had history, and I looked back and I saw that 2 years prior, there was the same issue around attendance, and I kept it as an accepted report because I felt like we needed to still try to help and engage the family and figure out what was happening. So there was a pattern of attendance when they were, 11 and 12. So yes, so
Right.
I would say call in a report after you've made those efforts. If you still can't engage with the family and get to the root cause of it, or recommend services or things for anybody that's still not improving, I would say yes, definitely call it in.
Okay, that's it for now. Thank you.
Okay, great. Thank you. That was great. I love questions.
Yeah.
All right, next slide. Okay. I thought it important to put this one up. I know that it's a little bit about educational neglect on the bottom, but it really talks about making a report, and that you're all mandated reporters. And if I could point out to everybody, you are our largest mandated reporter. It's you guys, school staff, it's the police, and then the hospitals that are our largest reporters, mandated reporters. So, you see these children every day, you engage with these kids every day, you have relationships with these kids every day. So of course you would be our largest mandated reporter. Kids are disclosing things to you. And again, you see them all the time. So there's two ways to make a report. In an emergent situation, and I stress this, emergent and non-emergent. Now, since December of 2018, schools have had the ability to file reports online, non-emergent reports online. I say that, keep saying that over and over again. An emergent one is if the child is in immediate harm, if there's a need for emergent care or mental health care, if there's a realistic fear of abuse or neglect within the next 24 hours, or that they will be inaccessible within the next 24 hours, that's emergent. Okay, those are the cases that you guys see where there's potentially the child has a mark or a bruise, or they're fearful to go home because they're going to be hurt, whatever. Those are the ones that you would end up calling in. All the other ones, the educational neglect, those types of situations can be made online. And we have a new portal address, and we've sent it out a couple times already. But please take the portal address that's up on top in red and make sure you share that with everyone. The one thing I have to say, and I can't impress upon it enough, we need more information in the online report, because remember, there isn't one person asking you the questions, and we need as much detail as possible. We're not getting that. We're getting like one sentences. And then it's causing us to have to call somebody back to try to get more information. And it really defeats the whole purpose of an online portal if we got to keep calling people back. So detail. I will, Ed, I'm not going to have you go yet. I'm going to finish up, and then I'm going to have you show everybody the portal if that'll work for everybody. Again, educational neglect on this sheet. Hopefully this sheet is helpful to you. It's a little one pager. You can print it, you can, use it and share it. It's got the little part down the bottom. It talks about educational neglect, and the cogwheels with kind of show you the three components about what we need when making a report. And again, detail, who, what, where, when, why, how. Okay. Oh, one more thing I want to point out. I'm not asking you to investigate, but there are situations sometimes that we don't have enough information to accept a report. So not asking to investigate, but asking for enough information in order for us to determine that it's an accepted report. Okay. Next slide. Okay. I put the truancy things in here, and these are straight out of SDE's website. So, I don't know if I need to go over it really specifically, but I think it's pretty self-explanatory. Again, a student whose parent is trying to engage with them and get them to school, and they're not going, and they're over 12, it is a truancy matter. So, I really think that ultimately prevention and our work together and collaboration and use of services, effective school-based strategies, outside services, truly engaging the family and the child to see what they need in order to engage them and improve their attendance is the best way to do it. Prevention is the thing. Not everybody needs to come to DCF's attention if we can engage them effectively to make improvements. Next slide. So truancy versus chronic absence. Chronic absences and truancy are not interchangeable. Sometimes we get those reports at the Carline, and really it's not interchangeable. They describe different aspects of the absence problem and require different approaches. So truancy is a term that generally refers to an unexcused absence. Chronic absence, on the other hand, incorporates all absences. So I just want to stress that again. And again, this is from the SDE website. These are things you guys are already familiar with. But we do get calls that people will make a report and say the child's truant and we're making a report of abuse and neglect or educational neglect.
Can I make a point here, Lisa?
Yes, of
I
course.
wanted to say that truancy, you know, it can have punitive, it sounds punitive, it can have negative connotations, label a student, but remember, truancy is only unexcused absences, and somebody has to make a decision whether or not that absence is excused or unexcused. That can be subjective. So I want to be sure that districts have very clear policies, practices, and procedures for when an absence is excused and unexcused, for who's making that decision, and to when you're considering a truancy, to really look at what's happening with the family more beyond just the notes. It becomes a paper chase. And so what's really happening, what's the root cause, and how could, instead of calling them truancy and looking for a referral, how can we support the family, and what does the family need to improve attendance, overall attendance?
That's perfect. I see a hand up. Do we want to do the question now?
It might have been my hand.
Oh, okay.
Yeah, that was my hand.
Okay. Next slide. And I just put in the law on this slide. So hopefully the handout will help you all as you know, going over what I talked about today, as well as what Kari has mentioned. So we can go to the next slide. Can wrap up a little bit. I put down on this slide, I put my number, all my information, and the other three names, Vanessa, Michelle, and Ed, are the program supervisors here at the Carline. Ultimately, many of you, if you haven't, you've either talked to me, or you may have talked to one of them. We are here for you. Should you have a situation that you're just not sure why something didn't get accepted, certainly we're available to talk it through with you and explain why something didn't get accepted, or if you have a question about if something should, you know, when in doubt, make a report. But you know, certainly we are here and available to talk with you. We put everybody's hours on this as well.
Mm-hmm.
I'm going to now turn it over to Ed Eckert to show you the portal. Hopefully that'll be a little helpful and useful.
Great. Thank you, Lisa. I'm the different Ed. So I don't work with the Carline with Lisa. We work sort of separately in two different divisions, but thank you for giving me this opportunity to sort of show you what we've built to give your staff an avenue to make those non-emergent reports. I'm going to share my screen now. Can you folks see my screen?
Yep.
You should see Google.
Yep. It's jumping up and down.
Great. So what I really wanted to quickly bring to your attention is, while Lisa's going to send you that one-sheeter and you can print out that URL and stuff, but if you went to Google and you just typed in CTDCF and you came to our homepage, right at the homepage, forward facing to the community, is a link to that non-emergent portal. So that's another easy way for your staff to leverage sort of what's already existent out in the real world. By clicking it, they're going to come to a web page, and you'll see sort of like similar to on your cell phone. Let me minimize this. Similar to your cell phone, different applications, and the mandated reporter portal is right there. While I have everybody, I wanted to not only show you what we have in play now for your staff, but I also sort of wanted to show you a little bit, look behind the curtain of things that we anticipate releasing to your staff, some enhancements, what we've made to the portal that'll be coming out in January. This is a testing environment. It's something internal to the DCF staff that work in IT that we're developing. You see an additional icon. We're adding in a different application as well to be leveraged and accessible to everybody through this portal. But I'm going to take you into the mandated reporter portal here and kind of walk through things. Everyone that has gone through the mandated reporter online reporting recently since June has had to create an ID Me account. This is so that we can make sure that everyone has their own identified secure access. We don't want people to sort of impersonate other individuals. And this gives a little bit of more ownership as to whom is making the report. I'm going to log in here. And right off the bat, once your staff log in, once we release the new enhancements, the screen is going to change. And what we've done and what we're building, what you see right now is not out in accessible in production today. But in January, your staff, your colleagues will have this experience as well. They're going to be brought to a dashboard. And what we're giving the users is the ability to see what their history of online submissions was. So in this instance, it looks like I made one in November, and then I made another one in May, both of which this year. But you'll also notice that I have sort of the top row is in red. What we're going to do is allow folks to begin an online non-emergent CPS report, and they can save it now. So in an instance, you're in a school, there's a fire alarm, you're worried that you're going to lose, all the information you've put in. We're going to give the folks the ability to save their progress and return and come back to that. So because of the audience, because we're schools and sort of sitting on that truancy and educational neglect discussion, I've mocked up an online CPS report this morning that is very much in line with the discussion here. And what I want to do is sort of just kind of walk you through what I have here for each of these tabs and give some context as to why each of these tabs are here. The first tab that a mandated reporter would experience is this disclaimer page. What we're really trying to do is make sure that any online non-emergent CPS report is in the right domain. If we want to make sure that, people that are mandated reporters are the only ones using this, that if there's any sort of life-threatening or emergent scenario, or, there's an unrealistic or a realistic fear for that child in the next 24 hours, we want those individuals to stop their online process and call the DCF care line. That's the nature of what this disclaimer page is. The bottom question also is our way to sort of figure out what questions are we going to present to different users. So we ask, many of these folks, do you work in a school? Do you work in a court? Do you work in a daycare? Those sort of questions, because we're going to cater different questions to who the audience is. And in this scenario, I'm picking school because later on in this process, there's going to be school-based questions presented to those mandated reporters. One other nice function that we've added that will be coming out in January is we're going to be storing a little bit more information about the mandated reporters to help speed up the process of their online submission. They're going to store things like their work address, their work phone number, what school potentially they work at. In this scenario, I've mocked it up that I work at Rock Hill Elementary School in Wallingford, and some, fake information here as well. But by doing that, we actually can speed up the time that it would take for, a school social worker or a principal or someone or a teacher to actually go through this process of making that report. What we're also going to be doing is making sure that the information that we collect for each individual adult and child is reusable. So a lot of times you're going to have a case where you need to notify DCF through an online report, and you're going to have an address, and potentially you're going to put in, maybe 4 or 5 different children associated with that same family. What we're also going to give these folks in January is a way to reuse addresses as they are entered into this mandated reporter portal. So if you have, a mother, father, and say 4 children, and you're really concerned about a non-emergent CPS report, the first time you enter that information relative to the address, it's going to store on the portal, and you'll be able to reuse that address each time for that specific CPS report as you add people in. This is very important because what Lisa mentioned here is that we want to get as much information as possible. And if we can make it easier for you to include, or your staff to include, all the adults, all the guardians, all the caretakers, all the alleged perpetrators, all the children associated with that CPS report, and we can make it easier for you to put that data in, it's going to help Lisa's team better assess whether or not to accept or not accept those CPS reports. I'll bring you sort of to child section where you'll be able to see we're going to be adding in information where previous used addresses will be stored. As I mentioned, it's the same as what I had on the adult. So the user would just have to select this and it would pre-fill and populate any previously used addresses for every subsequent individual that you would have your staff enter into this mandated reporter portal. So that's the first thing, right? We're going to capture who's the reporter. Actually, we're going to weed out anything that shouldn't be through this portal through a non-emergent online submission. Get the information for the reporter because it's so pivotal in being able to contact that reporter when a CPS report is accepted for investigation or a family assessment. Get that information. Then we're capturing who the adults and the children are. And then we're getting into the nuts and bolts of what the CPS report is for. What are the reasons? One of the biggest federally required pieces of information is the date of the maltreatment. So in this instance, I basically mocked up a scenario where a father of a 9-year-old shows up to this elementary school, Rock Hill. Child's never been involved in school, never been homeschooled, is literally just coming in, and the father's trying to get the kid enrolled today for a school so that child can begin his very first time being educated. So obviously this is outside those timeframes for when a child has to be enrolled or notified of homeschooling. And in this scenario, the school is concerned that basically we have a child here that's never been in that school system or in any formal educational platform at all. The more information in these questions, the better. I have some observations here. The child prevent is emotionally, socially, and educationally delayed just from the brief observations that the school has had with this child. Father's response as to why he claimed that he didn't know that his child had to be enrolled in school prior to the age of 9. Obviously a big red flag, right? Educational neglect, in my experience in 15 years of investigating maltreatment claims in Connecticut, has been that educational neglect is sort of like the doorway to underlining other needs to potentially for that family. We're also capturing additional information relative to specific schools, right? So in the beginning, at the disclaimer page, when the user selects that they're from a school, we are now giving them specific school-related questions. We're going to be asking your staff about education, special needs, child vulnerability. For situations where it's child in maybe a supervision or there's a child causing a maltreatment to another child, what sort of event took place in that scenario? We want to know what the attendance needs are, as I mentioned, and I just sort of briefly sort of mocked up, the child's 9, has never been in any formal school setting in this scenario. Child, father claimed just wasn't aware. This is something that still should be reported. We're outside that 5 to 7, that 7-year-old sort of timeline. And given the observations from the school as well, very concerning. The next tab doesn't apply in my mocked up scenario, but we have given additional opportunity for the mandated reporter to give us more specific information relative to these 3 very significant concerning risk factors. Intimate partner violence, or domestic violence as it's also known. If your staff or you were to click on this, we're going to be giving you specific IPV or domestic violence questions. These are not mandatory questions per se, but these sort of help guide your individuals as to what we are looking for to best to determine whether or not we should be accepting or non-accepting. In my experience, parents get into a fight the night before, the child comes to school, and they're going to disclose sort of what happened the night before. Was somebody arrested? Was somebody injured? Where were the children when the fight or incident took place? All very important pieces, and all of these data items are very important to Lisa's team. Human trafficking, obviously not a great topic per se, more prevalent as you get out of the elementary schools, but these are the things that we're looking for. Is there a pimp? Is this a runaway child? What sexual exploitation are you aware of? Again, the more information here helps the staff at DCF determine whom else we need to bring into the fold on those sort of cases. Do we need to bring law enforcement, Homeland Security, FBI, all of those different things that we have our network of people that help in these scenarios. the more information your staff can provide on these sort of claims as well are very helpful. And then substance misuse. We're changing some of the language here where you see the word drugs. We're moving to different language as well. But what we're trying to do is figure out what is being misused, what is the exposure to the children, where are the substances being stored, what are the ages of those kids, who has access to them. All of those pieces of this pie really help determine how we're going to respond to some of these scenarios, helps us determine impact to the child. And at the end of the day, that's what we really are trying to figure out when a substance misuse or a substance concern is coming forward to us.
Hey, Ed, I'm gonna have, we have to wrap it up a little bit.
Okay, very good.
Quicker, sorry. So could you just maybe move them through a little bit and talk a little bit about this, the attachment feature coming and things like that, maybe?
Absolutely. Absolutely. We are going to allow your staff to now upload different documents come January. They'll have the functionality of these are the different types of document types. There's a file sort of limit, but it's a pretty high threshold. So if you have attendance records, if you have, Lisa mentioned it, your notes sent home on those sort of truancy or educational neglect cases, any of those sort of documents that you have been sort of building up, sending them our way helps us make the best decision as to whether or not to accept or not accept. In this scenario, I sort of created a fake letter, and I'll show you how easy it is to this PC documents. You would just upload the document and it comes attached here. You could upload a bunch of them. In this scenario, what I did was just sort of a mocked up letter that the father's requesting that his son be enrolled today in that school setting. So if the father submitted this and you had, in another scenario, you had a bunch of attendance records, by all means, please include those in your CPS report submission. One other function that we're also providing is your staff at the time of submission will have the capability of one time having the ability to view, print, and download what questions they answered and what their responses were. Legally, we're being told that we have to allow this to be at this one instance. So this is their avenue where they'll be able to download it to a PDF. They can save it, they can print it, and they can store it to their own account. But all the questions that they answered, all of their responses, now they'll have that functionality. They'll have that documented and they can store that for their own records or whatever processes you folks have within your own districts.
However, once it's submitted, you will not be able to obtain it after that. So
Correct.
This is a one-time only. I know that was quick. I'm sorry, but I know that we have to move on. There's another speaker and I think we only have to 11. So
No problem.
Ed, thank you for doing
Sorry for going too long.
No, you did great. It's a lot of information and we want to
is.
get everything out to everybody as much as possible and share it and have questions, but thank you.
No problem.
Thank you so much. Great job, both of you, Lisa and Ed. But I'd like to actually now turn this over to Susan Lauria with Stamford Youth Services. And Susan, go right ahead. You can present.
Susan, if I can just interrupt you before you start.
Sure.
Because I wanted to kind of make a transition here because, we're hearing about education neglect and how to file for education neglect. And we know that since 2017, filing for truancy with the FWISN in the courts, the law changed. And it was put into the districts and to develop a system of supports for families with a community-based organization to support students who are truant. And the Youth Service Bureau referral form is sort of the other side of this issue when kids aren't coming to school. And so if it seems like we only have these options of educational neglect and truancy, but there's preventative and other ways to address not coming to school. And Susan Lauria works for the Stamford Youth Service Bureau, and she started just at that time when the law changed. And I thought her perspective on some of the things we heard today may be helpful. And so Susan, if you could share some of what you've done since you started back in 2018, I think.
Yes. Hold on, let me just share my screen. Um, okay, can everyone see my screen?
Yes.
Okay, so I did begin right in 2018, and that was when I first began. It was a 10-hour a week part-time job, and now it's turned into, if any of those of you involved in attendance know, a 24/7 type endeavor. My co-presenter today is Matt Laskowski, and I'm going to go through my part really quick because I'm more about process and Matt has all the magic. He has all the some positive interventions that were successful when he was a principal at one of our middle schools. And now he's involved in a different role in terms of finding additional pathways for our disengaged students. This is the article that you referred to, Kari, at the beginning. Stamford lays groundwork for remote learning and twilight school. I just moved this up. It was closer to the end, but I will have Matt address it in a minute. Very similar to what Lisa went through already, definitions of truancy versus chronic absenteeism. We look at chronic absenteeism now. And all of our efforts. This is just the history that Kari brought up before. In 2017, the law was changed to prevent the prison to school to prison pipeline. The YSBs were designated to be the agencies to handle truancy referrals. And to be honest, when I first came on board, we weren't getting any referrals. I pushed into all the schools and they were all under the impression that now truancy had been decriminalized and there was nothing they could do. There was nowhere for them to go. There was no consequences or possible remediation. And through the Office of Family Community Engagement, Mike Myers on here, who led our work and funds our work through LEAP, and I'm with the Youth Services Bureau. We've collaborated with all of these different community agencies to put together a system of tiered interventions. And when we talk about truancy, that tends to be more of a tier 3 intervention, kids that are significantly chronically absent. And what we put in place is this type of a model. As the prior speaker said, prevention is everything. And then we do all kinds of things. What I'm going to start talking about is through Here to Help. And I want you to think of as Here to Help, the collaborative agency between Stamford Public Schools, Youth Services, and all of our different community partners. And I'm going to go right up here to tier 3, intensive intervention. So a lot of what my colleagues and I were nodding our heads when Lisa was talking about referrals. We get a lot of referrals from schools. We get referrals from DCF. If DCF isn't going to take the case for educational neglect, because let's say it is an older student, we do presentations to DCF to have those students referred to us. Hold on, I'm going so fast, I'm losing my my thought a little bit. So we have a referral form similar to what DCF is doing. We also struggle with getting everybody that makes a referral to give us all of the information that we need to help a family. There's a couple things that Kari said at the beginning, excused versus unexcused absences. We do a lot of tier 1 work to make sure that our schools are even recording absences properly. I was telling Kari yesterday that we have a school that insists on making all absences unexcused absences. Well, think about that. You know, I as a parent have a right to those 9 absences. It's going to change our truancy data, but also let's say that family is involved in some type of a custody thing. You know, it looks like it's a lack of engagement and communication from the parents' side. I was going to show you an example of a referral that just came in yesterday. And this is an example of a great referral where the school has really given us a lot of information about what's happening with the student. And another thing that came up earlier that Kari mentioned is connecting with the families to find out what's really going on, where the Youth Services Bureau and the Office of Family Engagement and Here at Help come in, is that you have to actually connect with the family. Making a phone, leaving a voicemail, sending a letter does not count as connecting with a family. We have developed what we call a 3-2-3 protocol for our outreach. And that means that you attempt to contact the family by all 3 modes of communication, which means text, phone call, and email. You wait 2 days. If you haven't heard back, you contact them by all 3 modes of communication as well. And then you contact the emergency contact to say, listen, this isn't an emergency, but your name is listed as an additional contact. And we want to make sure that we have up-to-date contact information for the family. And we always get the up-to-date contact information. So a lot of our work is just engaging the family, actually getting them on the phone and finding out what's going on. So this was a referral that we received. You can all read it. And then we have a Here to Help outreach worker, probably similar to what DCF does, that will call the family. They'll call the school back and push back a little bit if the school doesn't give us any information. If it's just like, you know, we sent a truancy letter, and Kari and I talked about this yesterday. The truancy letters that begin with the legalese at the beginning are never successful. The negative letters are never successful. And do people even read their mail at this point? If we have complete information, we will have outreach callers connect with the family, get more information. Now, this is a referral that's going to go to one of our caseworkers. So we have 2 outreach workers now, and we have 4 caseworkers. And it's all about connecting with the family, engaging with the student, and finding out what's really going on. And our caseworkers do home visits. They meet with the school. They go to school and family meetings. And we try to, as you can see, this is a family with a lot of different issues to help remediate issues on all different levels. A couple other things I wanted to point out, and then I'm gonna, there's 4 minutes left. Turn it over to Matt. A couple of things that Kari and I spoke about yesterday is that you guys just said, I believe, Ed, that educational neglect is the doorway to other family needs. We look at chronic absenteeism as our early warning system. And to give you an idea of some of the things that we're seeing in Stamford that we're trying to confront is we had a group of chronically absent middle school girls. We looked at the patterns. They were frequent runaways. But again, the first kind of warning signal was chronic absenteeism. And we feel that they're probably involved in some type of sex trafficking in our community. And so then we are collaborating. We had a meeting with the police department, Office of Family and Community Engagement, the school. It's all about collaborating and using all of our resources to help a student and to help a family. I am going to turn it over to, we were also going to talk about an early intervention initiative that we're doing with our kids that were 10 to 12% chronically absent. And again, it's all about having the school staff connect with the family, connect with the student, try to analyze the needs. This is a chronic absentee kind of inventory that Matt Laskowski has implemented at the middle school level, and we'll send copies of our presentation. Here's just an idea of some of the questions to really get to the root, to the why is a student chronically absent. And then they're going to meet with the families and discuss it. He went through this at his middle school when he was a principal, and now we're implementing it at our middle schools and high schools. Now, Matt, I'm sorry.
Yeah. I'm gonna have to just break in for a second because it's
Sure.
10:58.
I'm sorry, I was a little disjointed there.
That's okay. No, you did great. And I think some of your points were just really remarkable and very helpful. So it's 10:58. We have our next Talk Tuesday is December 13th. For those of you who are going to jump right off right now, I'm going to ask Cirque to help us plan a follow-up session to this, because I think we could continue to dialogue. And so we have our December 13th session planned, but we're going to plan for I think the January a January session to follow up on this topic specifically. And so we can have more time to ask questions. I really feel like we need more time. And if Lisa and Susan are able to stay on a little bit longer, we can answer questions if that's okay with Cirque as well. We can stay and do sort of a parking lot after session. So I want to thank everybody for coming, and December 13th is our next session. So Susan, thank you. At this point, I see there's questions in the chat. Is there anyone who wants to ask a burning question that they have? One of the questions is, when is the new release of the DCF reporting that I see here?
So it's already out there, right? It was released in June. The revisions or the additional things, we're looking at January, February.
Okay. I think I got a question regarding the Stamford article, and that is behind a paywall, I think. So we will have that PDF'd and cited, and we will share with the group. If you are registered for Talk Tuesday, you'll automatically get these slides. We will send them out as soon as possible. With the PowerPoints. Yes, Ashley, if you're registered, you'll get them. If you're not, if you don't know, if you want to put your email in the chat, we can double check and make sure you get it. Are there questions? Anyone, any other interesting things? Susan or Lisa, was there anything you wanted to add before we go?
I would just wanted to add that the early intervention, let me stop sharing, sorry, that we were discussing. Matt has an interesting poster that he did for convention that shows the data with the reasons behind chronic absenteeism, and then the improvement in attendance after they implemented this plan across different student groups. So that's something that if we have more time or at another date, we'll be able to present.
Mm-hmm. Go ahead, Matt. Hi, Matt. Thank you.
Hello, everybody. Good morning. I mean, I'm happy to, I think, as many comments suggested, this work shouldn't be rushed because there's information to share. I think a couple points to clarify, but then there will surely be follow-up questions. And so I'm happy to jump on another meeting, even if you get something up in January. I'd be happy to participate.
We are getting ready to release the new guidelines for excused and unexcused absences. And so that would be a great time to align this with the release of that document, which has some changes that still need to be approved. So I can't give too much of a heads up, but really I'd like folks to focus on the reasons for the absences more so than on getting a written note for the absences. I know we need that documentation and that's so vital. There may be some flexibility around it being paper and pen versus something a little more modern than what we've had in the past. And it could be if you have Parent Square, or if you have an email system with parents or something electronic that may be more helpful. Another issue around attendance that I wanted that comes to mind that we're going to stress in this is the use of the school nurse as a medical note for getting the medical excuse. The school nurse is a medical professional who can excuse absences. And so families can call the school nurse in the morning to say, my child is not feeling well, and this is what they're presenting. Because going to a doctor, especially in these times, is a hardship. And for families and for doctors who are very busy and it's hard to get an appointment. And so with all of the respiratory illnesses that are going around, I just don't want to see these unexcused absences just be marked unexcused because somebody didn't make an effort to get a written note in when there really was a reason for an absence. If that's helpful. Any other questions? All right, I think I'm Lisa, Ed, Susan, Matthew. I'm sorry we ran out of time. We're gonna plan this again as a regular session, probably. I was talking to Christine, we need to do at least 90 minutes next time we do this. Because it's awesome to have like the state agency and then a district follow up with how they're really doing it. And we will plan something for January. And we'll touch base with Lisa and Matt and Susan around dates.
Absolutely. We'll be reaching out really soon because this is such valuable information. So we need to continue.
Yeah. All right. Well, thank you, everyone. Unless I'm missing anything in the chat.
I think you're.
Oh, well, nurses still need a medical note. No, nurses can write the medical note. Then they need to describe to the nurse what is happening and what are they presenting with for symptoms so that the nurse can say, no, she needs to come to school today, or no, she can stay home and I'll document that it's excused in the system. So I hope that's helpful.
One more question, Kari. That is, can parents just call in and say Johnny is sick and not require a note?
Parents can write, it would need to be documented whoever takes the call. It has to be documented in the student's file while the student was out that day. Can we, so whoever they speak with can document it and put it in the note, especially if it's the first 9 and they don't need the extra documentation from a doctor. If they need the extra 9, then they would have to talk to the school nurse or a medical professional and have that documentation. Does that answer the question? Here's someone typing. We will get that article to you around Stamford. It is behind a paywall. I didn't realize that was something that I have. So we will get that into a PDF and send it out.
We'll do the follow-up email and I'll attach not only the PowerPoint, but also some of the follow-up materials as well.
Mm-hmm.
Can I just add one quick note? I know many people are jumping off, but I do want to shout out our friends over in Norwalk Public Schools. Although I'm in the process of developing a Twilight program and a virtual program here in Stamford, Norwalk, I think they're the only district right now in Connecticut. They have a virtual school up and running as of right now. And so I have gone out to visit with those folks. And they also have a really comprehensive Twilight program that runs, I believe it's 4 to 8. And it's basically a full course load and students take it outside of the school day. So I want to make sure that they get recognized because they're doing the work and they really are leading this charge, and they've been a great resource for me.
Great, thank you.
Okay, thanks.
No, thank you. Thank you. I wish you luck with the work in Stamford. It is cutting edge, and it does provide opportunities for those students who the typical school day doesn't accommodate their needs. So, all right. Well, thank you.
Great. Thank you so much. Have a great day, everybody. Thank you again.
Thank you.
Thank you.